Good evening, everyone. Today I am discussing about goiter. Goiter is the abnormal enlargement of the thyroid gland, which is mainly caused by the iodine deficiency and which occurs in both hyper and hypothyroidism. Why it is caused by iodine deficiency? Because the thyroid gland takes the iodine from the circulation, which is about 98%. Because the ingested iodine is converted into iodate in the presence of peroxidase enzyme. This is enters into the small intestine, which is taken by the thyroid gland. Okay, this iodate from the circulation is taken up by the thyroid gland by iodate trapping mechanism. So the thyroid gland takes the iodine from the circulation. Okay, clear? This iodine thus forms the attached to the tyrosine molecule to form the triiodothyronine and thyroxine and a small amount of reverse T3. So the main etiology of goiter is iodine deficiency. Okay, and another cause is inflammation, Graves' disease, and thyroid cyst, thyroid adenoma, and thyroid carcinoma, and ingestion of goitrogens. These goitrogens includes lithium carbonate, some vegetables like cabbage, turnips, kale, cauliflower, sprouts, and some certain drugs like anti-thyroid drugs also. Okay, and coming to another cause is elevated TSH production, that is thyroid stimulating hormone, because the hypothalamus secretes thyrotropin releasing factor. This causes the secretion of thyroid stimulating hormone from anterior pituitary. This anterior pituitary stimulates the thyroid to produce thyroxine. This thyroxine is the iodine containing amino acid. Got it? And another cause for goiter is congenital also. And coming to the classification, first we can observe the normal gland. What is the weight of the normal gland? Is about 25 grams, and their volume is about 7 to 10 ml, and their location, which is caudal to the larynx and anteroposterior and surrounding the anterolateral part of the trachea also. And this thyroid gland goiter is differentiated on morphology and their function also. Depending upon their morphology, they are simple goiter. Simple goiter is puberty goiter, colloidal goiter, and multinodular goiter. And depending upon their function, the goiter is classified in toxic goiter. This toxic goiter is also three types: diffuse type, diffuse toxic goiter, and secondary thyrotoxicosis in multinodular goiter, and another one is toxic nodule, and third one is neoplastic goiters. They are also two types: benign and malignant. Benign adenoma is the example for follicular adenoma, and malignant goiters are two types. They are primary and secondary. In case of primary, depending upon their histopathology, they are well differentiated carcinomas, which is papillary carcinoma and follicular carcinoma, and poorly differentiated carcinomas are anaplastic carcinoma. Another one, arising from the lymphatic tissue, non-Hodgkin's lymphoma, and which is arising from the parafollicular cells, that is medullary carcinoma. And coming to the secondary tumors are their metastasis. These secondaries enters into the thyroid gland. Okay, they are malignant melanoma, breast cell carcinoma, renal cell carcinoma. And another one is thyroiditis. There are also three types. Uh, sorry. There are also three types: granulomatous thyroiditis, autoimmune thyroiditis, and reduced thyroiditis. And the other rare causes of goiter are acute bacterial thyroiditis, thyroid cyst and thyroid abscess, and amyloid goiters. And according to their palpation of the swelling, they're classified in three types: grade 0 and grade 1 and grade 2. In grade 1, the sweat, there is no goiter is palpable and also visible also. In grade 1 also, palpable goiter but not visible when neck is in normal position. In case of grade 2, cleanly swollen neck is seen but consistent with goiter and palpation. Okay, this is the classification of goiter. Then in the next class, we can talk about the simple goiter. Thank you.